My name's Katie. I'm going to be your student nurse today. Can you just verify your name and date of birth for me?
My name is Brittany, and my date of birth is 12/20/2001.
Okay. So my hand hygiene, just going to check your wristband. Great. Do you have any allergies that I need to know about?
No allergies.
Okay, great. So we're going to start off with checking your vital signs. So I'm going to begin with taking your temperature. So take this. Just open your mouth for me, please. And hold that under your tongue. Okay. Okay, 98.2. And check your pulse ox.
Okay, name is Cielo. Is it on you?
That is at 97. Great. So now I'm going to check your pulse. So give me this hand here. Good. Okay, so your pulse is right around 74 and respirations are right around 15. So the last thing I need to check is your blood pressure. So I'm just going to use this arm right here.
No, not a no, the cannula.
Oh, inner cannula.
I think there's already set up.
Inner cannula.
In your cannula, yeah.
There.
Thank you. I think we're like the first group.
Definitely not nasal.
I was supposed to back just being a work. Okay, I got it. So there we go. She placed it in.
Okay, and your blood pressure is right around 118 over 70. Sorry. Okay, so all your vital signs look good. Everything is normal. Are you having any pain at all?
No pain.
No?
Actually, I am kind of in my finger.
Okay, your finger. When did that pain start?
It started just last night.
Okay, and you said it's in your finger. What does the pain feel like?
It's kind of like a sharp pain.
Okay, and that's been going on since last night?
Yeah, probably like 2 hours.
Okay, does anything make the pain worse?
Yeah, if I write.
Okay, and does anything make it better?
Yeah, so Tylenol I tried. It
Okay.
actually improves it.
Okay, so you've tried Tylenol as a treatment. On a scale of 0 to 10, 0 being no pain at all, and 10 being the most pain, what would you rate it?
It's probably a 3.
Around a 3. Okay, well, we'll definitely try and get that figured out for you. So, observing general appearance, there's no signs of distress. Both sides of the body are symmetrical. And then you've already told me your name and why you're here. Can you just verify where we are?
We're at the hospital at HC.
Right. And what day of the week is it?
It's Wednesday.
Wednesday. Okay, perfect. So I'm just going to go ahead and check all of your equipment. I'd start with checking your oxygen cannula and just making sure that there's no kinks in the tubing and that it matches the provided orders in your chart. I'll also check your IV bag make sure that matches the provided orders in your chart. There's no kinks in the tubing, and that there's no breakdown or any pain at the IV site. And then lastly, I would check the urinary catheter. Just make sure that that is securely fastened to the side of the bed and to your leg. The skin looks okay around that area, and I would note the color, consistency, and amount of urine. So since all of that looks good, we'll move on to checking your hair, skin, and nails. So first I'm just going to check for your capillary refill in your nails. That looks good. And then I'm just going to check your skin turgor here on your chest. Good. So skin temperature and texture looks good. Color is normal for ethnicity. I'm going to check your scalp really quickly. All of that looks good as well. So now we will move on to checking your ears. So I'm just going to have you look that way for me. Look back here. Good. Check the other side. Good. And then for your eyes, conjunctiva color and sclera looks normal. I want you to look forward and move your eyes, but don't move your head. Just follow this light, okay?
Because you didn't close the door.
Good.
No, it's not. You can clear it out.
Okay, and we're just checking that your pupils are equal, round, reactive to light, and for that accommodation. So I'm going to have you look up for me, check your mucous membranes. Good. And can you open your mouth, say ah. Good. Lift up your tongue. Okay, great. And then can you just smile for me? Great, just to assess your facial symmetry, and all of that looks really good as well. So, are you having any breathing pain at all?
No.
No cough?
No.
Okay. And I can observe that you're not using any accessory muscles to breathe. Breathing does not appear labored at all. So I'm going to listen to your lung sounds. I'm just going to have you sit up for me, please. Okay. Just take a deep breath in. Good. One more. Okay, and I'm going to check your back as well. So just take a deep breath for me.
No, the line was clear somewhere.
Well, yeah, because I closed it.
Oh.
It's not closed. Keep it open.
Okay, looks good. And then I would teach the patient how to use an incentive spirometer and have them demonstrate use for me. So you're not having any chest pain at all?
No chest pain.
Okay, so we're going to move on to listening to your heart sounds. The point of maximal impulse is at the fifth intercostal space, midclavicular line. So we're going to begin with your aortic pulse. That's at the right sternal border, second intercostal space. Good. And then we have your pulmonic pulse at the left sternal border, second intercostal space. Your Erb's point at the left sternal border, third intercostal space. Tricuspid at the fourth intercostal space, left sternal border. And then finally your mitral pulse, fifth intercostal space, left sternal border, midclavicular line. Okay, so heart sounds are normal, rate and rhythm is normal, there's no extra sounds. So I'm going to go ahead and have you lay back down for me. Are you having any abdominal pain, nausea, vomiting, diarrhea? No. Okay, great. And then I would inspect my patient's abdomen, make sure everything looks normal. I'm going to listen to your bowel sounds in all four quadrants.
Yeah, that's what it's supposed to look like, that like slow red color, that like takes over the thing. Nah, man, it just turned all red.
Okay, it sounds good. And now I'm just going to palpate. We'll start with some light palpations and then do some deeper ones. Just let me know if you feel any pain at all. Okay. It's okay?
Yes.
do some deeper palpations. Feels okay?
Yep.
No, you have it written right.
Okay. And I did forget to ask your last bowel movement. Was that normal?
Yes.
Okay, good. As far as urination, has your urination been normal? Normal frequency, amount?
Yes, all of it's been normal.
Okay, and I would monitor intake and output as well. Do you have any numbness or tingling at all in your arms or legs?
No.
None? Okay. So we already palpated your radial pulse and assessed for capillary refill. So I'm just going to check your pedal pulse. Good. And have you push back against my hands. Good. Push up with your legs. Perfect. And then I'm going to put my fingers out like this. I'm just going to have you grab and hold on to them, okay? Okay, good. So grip strength is good. So I'm just going to make sure we have this call light right here within your reach. Do you know how to use your call light?
Yes.
Okay, great. And then I'll just go ahead and put the bed back down for you. Okay. Put this back up. And is there anything else I can get for you today? Anything else that you need?
No, I'm okay.
Good? Okay, great.